A hospital stay, it's supposed to be about getting better, right? But for so many older adults, it can actually trigger something, something terrifying and really misunderstood. Today, we're going to pull back the curtain on a condition that's hiding in plain sight and show you why, as a caregiver, you are the single most important line of defense your loved one has. So picture this. Your mom or your husband is in the hospital. They're recovering. You walk into their room and they just seem off. They're confused, maybe a little agitated. Maybe for a second, they don't seem to know who you are. And that one thought just rips through your mind, the scariest one of all. Is this it? Is this dementia starting?
But what if it's not dementia at all? What if it's something called delirium? And here's the absolute crucial point, the thing you have to hear. Delirium isn't just a little bit of confusion. It is a full-blown medical emergency that needs immediate attention.
To really protect someone you love, the very first step is knowing what you're actually looking at. So let's break down the critical differences between delirium and dementia, because honestly, telling them apart can change absolutely everything.
So what even is delirium? Well, the official definition calls it a sudden and fluctuating disturbance. Now, those are the two magic words, sudden and fluctuating. This is not a slow, gradual slide. It's like a switch flips in the brain, a really abrupt shift in how someone thinks and how aware they are of the world around them.
This chart right here really spells it out. Look at the onset. Delirium hits hard and fast, while dementia creeps in over months or even years. And the progression is totally different. Delirium can come and go. Someone might be perfectly clear in the morning and then deeply confused by dinner time. But the last line, that's the most important one. That's the one that gives us hope. Delirium is often reversible. All right, knowing the definition is one thing, but really grasping what a delirium episode is like, that's something else entirely. We're talking about something way beyond simple confusion. For the person experiencing it, it is profoundly distressing, and frankly, it's dangerous.
And the scale of this problem? It's huge. Every single year, 7 million hospitalized Americans go through delirium. It can happen to anyone, sure, but it's incredibly common in people over 65. So this isn't some rare thing. It's a massive, widespread crisis.
This quote, it just gives you a chilling peek into what's happening in their mind. These aren't just jumbled thoughts. Patients can have vivid, absolutely terrifying hallucinations. One man described being on a stage covered in blood. Can you imagine? Others have had delusions they were being burned alive. It's a state of pure terror. And the consequences of that terror ripple out, way beyond the hospital room. Delirium is linked to a much higher risk of falls. It means longer hospital stays, and it even increases the death rate. And that psychological trauma, it can be so bad that patients develop symptoms of PTSD, literally haunted by these experiences long after they're better.
So the big question is, why is this happening in the one place people are supposed to be getting well? Well, it turns out that the hospital environment itself, mixed with certain medical treatments, can create the absolute perfect storm for delirium to strike.
Now, this is a truly staggering statistic. For patients in the ICU, the intensive care unit, the risk of developing delirium skyrockets to as high as 85%. Just let that sink in. The sickest people in the hospital are also the most vulnerable to this devastating mental event.
So what's causing it all? Well, it's a whole cocktail of things. Heavy sedation, being on a ventilator, the trauma of recovering from surgery, these are all huge stressors. Sometimes it's something as simple as a urinary tract infection. And then there's the environment itself. The constant beeping of machines, lights on at all hours, people coming in and out, completely wrecking any chance of a normal sleep cycle. Okay, we've painted a pretty grim picture, I know, but this is where the story pivots. This is where you come in, because a huge number of delirium cases can actually be prevented. And you, the caregiver, you are your loved one's absolute first line of defense. The next number I'm going to show you, it might be the most important one you hear all day. It's 40%. That's right, 40% of all delirium cases are considered preventable. That is a massive window of opportunity. It means that if we are aware and if we advocate, we can stop nearly half of these terrifying episodes before they even have a chance to start.
So what can you actually do? First, question the medications. Don't be shy. Ask the nurses about any new drugs, especially things like anti-anxiety meds. Second, push for mobility. Gently advocate for getting your loved one out of bed and moving around as soon as it's safe. Third, help create a calm space. Ask if the lights can be dimmed at night, make sure there's a clock and a calendar they can see. These little things, they can make a world of difference.
Now, all this knowledge we just talked about, it's only powerful if you actually feel like you can use it. And in the confusing, often intimidating world of a hospital, you have to remember, your voice is a lifeline.
Think about it. Doctors and nurses come and go on their shifts. But you are the one constant person at that bedside. You know your loved one better than anyone. You know their baseline. So when something just feels off, you're the first one to notice. You are their early detection system. When someone is sick, when they're disoriented, or they can't speak clearly for themselves, that is when they are at their most vulnerable. Your advocacy, your questions, just your presence, that is their protection. You are their voice.
So we'll leave you with this thought. Knowing the difference between delirium and dementia, understanding what triggers it, and recognizing your own power as an advocate, that's step one. The next step is always action. So now that you know the signs, the real question is, will you be ready to speak up?